Hello, my name is Steve Barber. I'd like to welcome you to our webinar today, which is entitled Introduction to Low-Level Lasers. As you can see from the introduction, I have extensive training and certification in all laser brands. For the past 25 years, I've been involved with Class 4 lasers, training surgeons on laser procedure certification. Also training doctors and therapists on Class 3 lasers for co-laser treatment. And so I'm also actually co-founder of American Society of Laser Therapy, as well as CEO and president of American Laser Institute. So I have extensive experience, again, in all laser wavelengths, and I've been doing this for a number of years, and I think you'll find this a very interesting presentation. Okay, next slide. So we'd like to have your feedback during our presentation. Please ask any questions to our lab chat, as well as any of us in particular feedback, positive or critical. We want to continue to enhance our viewer experience with your help. All right, to get started, there's some terms you need to understand and know to become familiar with lasers. So laser terminology, the first one is nanometers. Nanometers designates nanometers a means of a meter, and it designates the type of wavelength that is used. And as we'll talk about it later, wavelengths determine the absorption of light in tissue, and they're all categorized in what is called a nanometer scale. Milliwatts describe power of a laser, and we're talking now about the difference between Class 3 and Class 4 lasers. For this presentation, we're talking about Class 3 lasers, which are less than 1 watt. Typically, anything less than 1 watt is considered to be a Class 3 laser. Anything 1 watt and greater is considered to be thermal and a Class 4 laser. The next term you also hear a lot about is photons. Photons are a bundle of energy that actually are used in the delivery of the laser therapy to the patient. And the final term is joules. And the definition of joules is energy times time. And that is how all lasers are dosed out, whether they're Class 4 surgical lasers or Class 3. Everything is designated in terms of joules. And we'll talk more about that as we go through the rest of the presentation. Laser properties. This is what makes a laser a laser. Monochromatic, meaning sync color. Coherent means that all of the wavelengths are in step with each other. Collimated means that there is no scatter from the skin. There's a tight band of photons all the way down to the cell. And this is what makes a laser as opposed to, say, LEDs or light-emitting diodes, which we'll talk about later, which have none of these characteristics. Okay, laser tissue absorption. This is really the entire laser physics concept regarding any lasers of Class 3, Class 4s. And this is called a nanometer scale, or as they term it, the electromagnetic spectrum of light. And the nanometer scale measures the tops of the wavelengths from one to the next. And so again, a nanometer is a nanometer scale, and nanometer is a measure of a meter. So if you can imagine anything less than 700 nanometers, short wavelengths, visible light, superficial penetration, because of visible light, they only go down to about a centimeter. And as you know, light reflects off the skin, so it's a very shallow presentation. So to get the longest, deepest penetration, you've got to go infrared. So any wavelengths greater than 700 nanometers, the wavelengths become longer, infrared, and deeper penetrating. And if you'll notice, 830 nanometers is microlight. You'll see a couple more in 904. There's 2 or 3 other lasers, TerraQuant, and a couple of others that fall in that category. And then 1060 happens to be a surgical laser, which is a ND-YAG, neodymium YAG, Class 4 laser. And just a comment or two, you'll notice 830 has the deepest penetration of the least amount of absorption of light. And this was actually proven over a period of years. There was early work done back in Asia and Europe in the 1990s, 1995, that indicated 830 nanometers was the ideal wavelength that had the least amount of absorption of light in blood and water or hemoglobin and myelin down to depth of 5 centimeters. and that was verified over the past 15, 20 years, studies that were done with the FDA, which we'll talk about later and go in more detail. So anything less than 700 nanometers, visible light, short wavelength, anything more than 700 nanometers, long wavelength, deeper penetration, and infrared. Laser classifications. There are actually 3 classifications of lasers. In effect, there are really only 2, Class 3 and Class 4. But under Class 3, there are actually a Class 3 and a Class 3B. So let's talk about Class 4 first. Class 4 lasers are thermal lasers. They're 1 watt and greater. Typically, these are the ones that you see used in surgery, such as Indi-YAG lasers, Holmium-YAG lasers, argon lasers, and CO2 lasers. So they cut, coagulate, or destroy tissue. That's Class 4. Class 3 lasers are where all of the low-level co-lasers are categorized. And then, if you'll notice, Class 3A at the top, and also Class 3B. I'd like to discuss that for a minute. Class 3B laser is what is called under NFDA. FDA calls it an NHN approval. And a Class 3B laser category was basically microlight laser, which was approved as Class 3B laser by FDA February the 6th, 2002. And the difference was it had medical double-blind studies. So if you look at the approval, you'll see that it was cleared for a treatment as a laser with medical double-blind studies, indication risk pain associated with carpal tunnel syndrome. So microlight lasers did a 12-year research through FDA, 2 medical double-blind studies, 300 investigators, and were approved again in February of 2002. And then what happened was, within about 3 years, some additional companies came in the market from Asia and Europe, and they came through the FDA under what is called a predatory claim or an ILY claim. Rather than do any studies or research, they decided to find a like device that had already been approved by FDA. It was cleared, and so what they a device called a heating pad. Heating pad was cleared by FDA and had been for a number of years, and so what they did is they decided to go with that as a model, and they attached themselves to that device, and it's called under FDA what is called an ILY claim, which is a heat claim. So what happened was, because they needed to generate heat to qualify as a heating device, ILY, they added LEDs to the bottom of their lasers. So if you have a chance to examine any of the lasers on the market, what you will see are LEDs on the bottom. Well, certainly they have some laser diodes, but they also have a lot of LEDs which satisfy the heat claim. Therefore, they got on the market without any studies in a matter of 60 or 90 days. So the only one that has any studies, medical double-blind studies, it does not use LEDs, is microlight lasers, and they were actually approved as Class 3B, first one in the world. Class 4 lasers. There's a lot of interest now in the last couple of years. Class 4 lasers originally were exclusive only to medical doctors to be used. And Class 4 lasers, by definition under FDA, cut, coagulate, or break tissue. Also, they're a fire hazard, and in surgery, for example, they have signs on the door. Every surgery unit has a designated person as a laser safety officer that's responsible for all the equipment to be, for example, locked up when not in use and to be used properly. And so Class 4 lasers are surgical lasers by definition. And lately you've heard a lot about laser therapy and Class 4 lasers. There's a couple of lasers on the market. One in particular goes up to 10 watts. And I will tell you that 10 watts is where actually CO2 lasers start. And CO2 lasers are a cutter. You can actually do surgery at 10 watts. So there's a couple of companies out there that are promoting this as deeper penetration, but you have to hold it off the skin, because if you put it on the skin and you had continuous pulse, you would damage the patient. So they're promoting this as going deeper, and the problem with it is they really don't know how deep it goes. It could go through the substructures of the body, or it could go through bone. So they're very dangerous, and they're used in a pulsing manner, held off the skin. So I would say at this point that there hasn't been a lot of speculation yet regarding lawsuits, but I expect there will be lawsuits before it's over, and there's going to be patients involved who have been damaged, and there's evidence for sure that these lasers do cause scar tissue, and they can penetrate bone. They can actually go through a spinal cord. So they're very dangerous, but they're promoting these as therapy, for use for therapy. And obviously there's another way to do that, and that is using Class 3 lasers. Class 3 lasers are safe. They don't generate heat or electricity, and we'll talk more about that in a minute. So there you see there's more information about Class 4s. There's a lot of information regarding these lasers, and they're workhorses in surgery. That's primarily where they came from. And you'll find that they're restricted to use by medical doctors only. And in some cases, insurance companies will not write a policy for anybody other than a medical doctor because of the enhanced liabilities. There's more information regarding lasers, for Class 4 lasers, and the risk involved are, if you've ever been around a Class 4 laser, you've noticed that there are signs everywhere that says danger, lasers in use. And one of the other dangers is you can literally put somebody's eye out in about a second. So Class 4 lasers are dangerous. They burn. They can put your eye out in a second. They can start a fire in the surgery or in your clinic because of the amount of heat they generate. And again, they're used off the skin. They move them back and forth very much like an ultrasound. You know, the problem with an ultrasound is that you put it on the skin, but you have to keep moving it, or you burn the patient. And so if you can imagine, ultrasounds go to 4 watts, and they've had burns reported every year by ultrasound, and a lot of, several hundred burns a year by some companies. So you can imagine what's going to happen with a 10-watt unit that's almost double the amount of wattage, such as a Class 4 laser. So I predict that there'll probably be some lawsuits, and then this will probably be, next few years you may not even see them except in surgery. Okay, LEDs and SLEDs. First of all, LEDs are they're light-emitting diodes, and the other is super light-emitting diodes. So the LEDs, the nanometers, they typically go up to, they're all anywhere between 635 and 903 wavelength. They're all over the place. Milliwatts, they do approach 1 watt. You'll see some that typically are between 500 and 800 milliwatts. So they heat the tissue, and they're not a laser. And again, all they are is a heat device, and in the case of some of the laser companies that are out there, this is how they actually receive market approval from FDA, by meeting the IOR heat claim with use of LEDs on the bottom of their laser. There's a number of studies been completed, effectiveness of laser light to LEDs, and you can do your own research on it later, but just know that LEDs typically are superficial, they're absorbed at the skin level, and they don't penetrate any place. Okay, here's IOI claims we were talking about earlier. Here's the FDA laser classification, Class 3 lasers. And this claim is indicated for use to emit energy in the infrared spectrum to provide topical heating for the purpose of elevating tissue temperature, with temporary relief of minor muscle, joint pain, arthritis, muscle spasm, relieving stiffness, promoting relaxation of muscle, and to temporarily increase local blood flow, circulation where applied. If you read this exact indication, it is the one that is actually used by heating pads. If you look at the same indication for heating pads, you would see the same terminology. Nowhere in this terminology does it say laser. Nowhere in this terminology does it say light. And so they're talking about using heat to increase blood flow into the area and relieving arthritis and some other conditions. So that's an IOI claim, or we call it Class 3A lasers.